1976. Others simply do not like being required to take a vaccination when the seriousness of the illness or the anticipated pandemic is not certain. Over the years, states have passed exemptions to the mandatory vaccination programs. Most common exemptions are for medical and religious objections, but physiological or moral objections are also provided basis for exemption. Thank you.
Go ahead, Sam.
Alright, well my name's Samantha and I'm also against the mandation of flu shots. So according to Jefferson in 2011, this is a matter of basic human rights. It should not be forced. And there is a situation reported in 2011 of a nurse that was actually fired for refusing to have the flu shot. She refused to have the flu shot due to the fact that she was pregnant and concerned about the presence of thimerosal in the shot. Nurses and the general public have wanted to refuse the flu shot for philosophical, religious, and medical reasons. The protection the vaccine provides is variable, according to Jefferson 2011. There is insufficient scientific evidence for the federal government to promote mandatory influenza vaccination programs that do not have an option for the healthcare personnel and other members of the public to decline for medical, religious, and/or personal and philosophical reasons. Everyone could agree that healthcare workers should not be fired if they refuse the flu shot for medical reasons. It's the religious, personal, and philosophical reasons that create controversy. Universal precautions renders the need for the mandation of the flu vaccine moot. If everyone is following universal precautions, there shouldn't be the need. When all of the hospitals that have mandatory programs haven't been able to show any reduction in the influenza among their patients, even after 5 or 6 years, it's hard to make the case that the science has been firmly established that in fact the vaccine makes that much of a difference. Firing non-compliant healthcare workers for refusal of flu vaccine can create more skepticism about the vaccine. The right of the individuals and parents to make their own vaccine choices is imperative. In my opinion, firing non-compliant healthcare workers is just going to create tension in the workplace. According to Ottenberg 2011, an employer can require alternative measures to protect patients. Many hospitals require unvaccinated healthcare workers to wear surgical masks during patient care throughout the flu season, for example. Infectious disease societies do not endorse exemptions for personal beliefs, but some do allow for religious objections. Everyone agrees that the influenza vaccine is an imperfect vaccine. It has to be produced every year, grown in chicken eggs in a cumbersome process, and glitches in the manufacturing process have occasionally led to delays or shortages. Again, according to Ottenberg 2011. Because the effectiveness varies significantly, even people who are vaccinated sometimes get influenza and can transmit the virus. And when a new strain emerges, as in the case with H1N1, a vaccine is not available for about 6 months. The drawbacks of this particular vaccine makes it hard to justify a vaccine mandation. Most of respiratory disease circulating in the winter is actually influenza-like illness, but not influenza itself, according to Ottenberg 2011. The vaccine has no effect on non-influenza viruses. Meanwhile, hospitals rarely require patients or visitors to be vaccinated, leaving patients vulnerable even if healthcare workers have been vaccinated. The implication is that if you get this vaccine, you will not get the flu. It's a false sense of security. The vaccine is not a sufficient alternative to being masked and using universal precautions. Mandatory vaccination overshadows the importance of other infection control precautions, such as encouraging health care workers to stay home if they are sick, and isolating patients or placing a mask on coughing patients if possible, as well as basic things like hand washing. This trend of placing patient safety over employee basic human rights and safety portrays a negative perception of occupational health amongst our employees. Thank you very much.
Thank you everyone for your great information. We will now break for 10 minutes and you guys can prepare a rebuttal.
Okay,
Yeah.
points were and everything.
versus work attendance.
Can you get little ones? What is it? Is it work security? Job security? Like when you feel like confident that you're gonna have your job tomorrow? Like you
Yeah,
know,
job security.
do you want to maybe make a point about that?
Yeah, we can.
Just creating some more tension and discomfort at the workplace type of deal. I was doing fail, duty of care, and then I had universal precautions are actually better, and that is much less controversial in terms of human rights. Frontline of defense, the flu vaccine was their argument. Alternative prevention measures. Oh, I can mention the alternatives that you said. 10 to 49 is the age that's effective, also an age that can be educated, therefore there are other preventions. Accessible, cheap, free. And we said it's slow, it takes up to 6 months. And what's the cost of false security? Like what implication of that? Ethical and financial solution. Ethical, it's a violation of rights, so is it ethical? Financial, compliant hospitals show no decrease in the flu, that's scientifically speaking.
And we had the infected still wear universal precaution. Only 49% of healthcare workers in 2000 got it. It shows the public attitude of dissatisfaction. New medications yearly, we don't know the full long-term effects.
There's a question that someone asked me, that the class asked. That's what we can answer for.
Okay.
That took us all 3 minutes to discuss. That's okay. Okay. What other kind of things that we can fight against or make a rebuttal for? I feel like a lot of the points I made, I didn't really explain clearly.
Can I explain some of them? It's kind of add-on point.
I can go through some more details of this one,
Yeah, for sure.
or you can, because it was your article. But if you want it like written out like in point form like this, I can hand you my paper. And we have these alternatives to the flu vaccine. I guess if people were vegans, they'd be against it because it's grown in chicken eggs.
Yes,
So that would be
true.
kind of cruel to force them to.
Get it. And it's personal instance.
Yeah. That's why people that are allergic to eggs.
I get it.
It just
Yeah.
Right. That's what I was writing. That's all things long-term. Just because we announce ourselves right doesn't mean we need to start.
That's true.
All right, the opposition to the mandatory flu shots is ready whenever you guys are. No rush.
We're also ready.
Okay, so we will start with the affirmative, and you guys will have 3 to 5 minutes to present your information, and then we'll go to the negative, and you guys as well will have about 5 minutes to present your information. So, affirmative side, whenever you guys are ready.
So regarding isolation measures, those measures are only